Here, third one is psychiatric medications don't work. You have to look into placebo research. The problem is a lot of conditions have a lot of placebo response, not just psychiatric conditions and not all psychiatric conditions. You have to ask, if psychiatric medications don't work, what are you comparing them to? And again, just for your information, if you sort of look scientifically at some of the stuff that Scientology and the CCHR and their fields talk about, there's basically good evidence for St. John's wort and mild depression as a single treatment. There's reasonable evidence for some other treatments in mild and moderate depression only if they're added to mainstream treatment, and there's poor or no evidence for anything else. That's the bottom line, that you will see all sorts of other treatments being proposed. The medicines are dangerous. Again, the issue there is compared to what? No one talks about the baseline severity or the baseline prognosis of the psychiatric conditions. Yet you do that routinely in cancer. Cancer chemotherapy is brutal and it kills people, and we kind of all collectively understand that. But compared to the condition it's being used for, you weigh the pros and cons and you take the treatment, and no one says that oncologists are cruel bastards who choose to administer this to their patients. As an example, untreated attention deficit hyperactivity disorder, which is a favorite whipping boy of Scientology, just has an enormous number of difficulties, problems, and issues. And so it's not just a matter of, well, should I take this psychostimulant or not? Does it have side effects or not? It's what will happen to me, what happens to folks, who share some of my characteristics if they don't take it. And that's what you need to think about. In terms of us being money-grubbing, pill-pushing, uncaring people, that's some results from the Canadian Medical Association 2004 physicians survey, and it shows that our preoccupation with earning potential prestige are actually less than that of family docs. 2 minutes, okay. That's another example of why that's an issue. In BC last year, look at all those, the frequency of how many times psychotherapy items were billed versus the number of times that a med check was billed. This is not a profession that just wants to crank guys through and give them drugs and check that. It even goes against their economic best interest, because doing an hour of psychotherapy pays $20 less than cranking through 4 guys doing 15-minute med checks in that hour. This is important because, again, this is an example of why all of this stuff has collectively seeped into the environment. That magazine came out just last month, and it's basically antidepressants don't work, and studies suggest that popular drugs are no more effective than placebo. In fact, they may be worse, blah, 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 blah. If you actually look at the study from JAMA that article is based on, it's a completely different story, and you can see the hype and the ideas, that have been fostered by Scientology going into even a mainstream magazine. Severe depression responds very well to treatment. Chronic depression responds very well to treatment. Very mild depression for very short periods of time can respond to placebo just as well as it does to treatment. That's the bottom line, and you would never ever guess that if you just looked at that magazine like that. Those guys also fall victim. That's an old magazine. Diagnoses Are Not Diseases, a skeptical analysis of psychiatry by Thomas Daz, in that particular magazine in the early 90s. It's become popular for skeptics to look at psychiatry as the black sheep of medicine, and to sort of pick on psychiatry and say, well, you guys aren't, like the rest of medicine. You guys are not quite as scientific. You guys are not this and not that. And there's a lot of skeptic literature out there that is that. But I would like to turn that around and say, when you hear about psychiatry getting beaten up, or you hear about these thoughts thoughts that get promoted out there, these sort of underpinnings of this hatred that has been popularized by Scientology all these years, I want you to be skeptical in the reverse direction. I want you to think, where is this coming from? I want you to put names of people that are saying this stuff. I want you to search it on CCHR and Scientology databases, and I want you to dig and be skeptical, because you will find a lot of the anti-psychiatry rhetoric in this world is coming from these guys. Thanks.